How are you?
How are you?
Thank you. So thank you very much. It's an excellent, excellent presentation. And I think that just to add to something that Dr. Salman mentioned, I think that it's worthwhile for all of us to understand that as far as I'm seeing, the quality is unrivaled. I think that we're getting the brains and knowledge from all over the world, and we should all take advantage of it. There is a question that I have for our panelists that I'm very, very interested in, especially when we were talking about why there's so much hesitancy of people getting vaccinated. We have a player now in healthcare that has always been there, but that especially in the recent advent with people having access to even the hard data that we as health professionals use to make decisions of whether to do something or not, implement a therapy or not, that player is the patient themselves. That player is the community itself. And now with the advent that people have access to a lot of different information, some of it valid, some of it not, some of it maybe. And we as scientists, as health professionals know that sometimes we have to kind of like approximate and do what we feel is best for the community. How it can we now address the concerns of the community, the concerns of the people that we are treating in an effort to now understand that they're actually a player. They are sitting next to us looking at this data. And now, for the first time in medical history, we have to admit sometimes we're kind of like going to figure it out as we go along. Now we have to admit that sometimes we really don't know if it's going to work or not, but we'll make an assessment and maybe change our mind later on. How can we address that um, that that new participant in healthcare development now? And especially in a world where there's a lot of miscommunication, some of it inadvertently and some of it on purpose.
Okay, Dr. Shakir.
Thank you very much for the very good question. And I agree with you. Patients are now getting more informed about the conditions they are having and how they approach them, and they think the right approach to them. But there's only one point we skip sometimes and look at the patients more than we should. There is data and there is data interpretation. They don't and cannot interpret the data as we do. They will look into simple facts and they cannot relate like what is research, what is a YouTube video of someone crazy talking about describing correct things like number of deaths associated with one of the vaccines. But what does that mean from the population point of view? If you take it individually and think like a 29 years old young girl who could have survived if she had the disease, but she had the vaccine and developed cerebral thrombosis and died, and that's a disaster, a catastrophic outcome. That is a way to look at it. But if I look at it into like, if I vaccinate 1 million people, less than one of them will have this complication. So looking at it from a population point and look at it from statistical point of view, comparing it to even regular medicines we take, like acetaminophen or any of the medicines, or like, non-steroidal anti-inflammatory drugs might cause heart problems and can kill people more. Smoking can kill people more. So if you look at it from that point of view, your assessment will be much more rational compared to what a patient can do. That's why I believe like sending the facts and doing those simple comparisons to people who are, I don't want to say simple-minded, but people in medicine and in interpreting data at that level are not going to be as successful as a researcher can do. That is the point I'm trying to say. More information, more simplified information. And it's very hard sometimes to simplify a very like sophisticated medical or science fact to lay people and tell them this is right, this is wrong, and they will understand it. But we'll have to keep on trying.
Okay.
Thank you very much.
Thank you so much, Dr. Dr. Shakir. Dr. Rafid Aziz, you have any question?
Mute.
Yes.
Good evening, everyone, and thank you for this. I'd like to thank my colleagues, presenters, for the excellent presentations, and also I'd like to thank all the people joining us this evening. It is really important to educate the people, but I feel most important also to educate the health professionals. I mean, health personnel is the problem we have in Iraq. It's not only the people in Iraq. The media is weak. They talk about negativity more than anything positive. And that's affecting not only our population, our patients, and our people there, affecting our colleagues in Iraq. So I think we need to work in two parallel ways. One of them is to target the health professionals, and second is target the lay people. I would like to thank the Iraqi BMI for their hard work towards that, but I think we need more work and we need to work together towards that. Also, the timing of these educational events. I mean, I'll give you an example. I mean, in our United Iraqi Medical Association talk about vaccines, and Professor Shak Jawad was with us as well, we targeted the day of the presentation was just 2 or 3 days before the start of the vaccine in Iraq, the vaccine campaign. And in the next day, we noticed that there was a high demand on the vaccine from the people. Attended the meeting was about 1,000. This is all then went into word of mouth, into social media, and into other ways to go to the people. In our WhatsApp groups also, we target our colleagues in Iraq, their professionals. We want them to lead by example. I mean, I got so many calls from people as relatives and friends in Iraq. And when I tell them when I encourage them to go take their vaccine, they tell, oh, but Dr. X told me no need to do that. Already you had your infection, you already been infected. I mean, this is a doctor telling the people that. That's why it's very important to target the health professionals in Iraq, and as well as targeting the lay people. These seminars, webinars, conferences are very important, and we need to have more of them. The other things are the media in Iraq. I mean, we need to work together. How we can target the media in Iraq. Unfortunately, there should be some reform to the media in Iraq. And I would like at the end to thank you all. I don't have any question for the panel. Thank you very much for the excellent presentations.
Okay.
I wish you all the best. Thank you.
Thank you so much, Dr. Rafa. Thank you.
Can I comment on this? Can I comment, please?
Okay, just 1 minute. Okay.
No. Just quick comment.
Okay.
Just because we have gone through this before. To be honest, I quite agree about the targeting the public. But the problem is that there have been numerous meetings about this, and yet those who are ignorant, unfortunately, remain so for some reason or another. I have to be a little bit hard in my comment, which is why I thanked very much Dr. Jassim Al-Azzawi for his hard stance with those who are misleading the public. وخل احكيها بالعربي. احنا اذا ما عندنا اعلام مركزي في هاي المسألة، لأن هاي المسألة تمس الأمن القومي، ماكو الأمن الصحي والأمن القومي. Those who start talking rubbish and misleading the public, they should be punished, full stop, and there should be regulations for this. هنا if you do something against things, you will be يطلع رئيس وزراء، يطلع وزير من يحكي الكل يسمعوا له، مثل ما تفضل دكتور سلمان الغاف قال يسمعون الناس هنا. زين نسمع هنا. So I'm sorry, there's no place for these media قناة فلان وقناة ما أقدر أسميهن، يطلع واحد يحكي nonsense. There must be some central sort of direction to this. Thank you very much.
Thank you so
And
much.
that's what I meant. There should
Thank
be
you. Thank you.
central
Excuse me,
central
Dr.
control of the media.
Yeah.
As with the everything else, like the vaccines, regarding the protocols for the treatment, there should be, it all should be centralized. The other thing regarding the نقابة الأطباء ووزارة الصحة, I remember there was a first doctor who was struck off the GMC register in the UK just because he mentioned in his social media on Twitter somewhere, he said that the COVID is a conspiracy. He was struck off immediately from the GMC. There's no way to ask him to apologize or to come back and put a video or something. Oh, I'm sorry, I did that. No, the harm is done and you should be punished. And the punishment here, they struck them off of the GMC. That's it. And that should happen in Iraq as well. Thank you very much.
Okay, thank you so much. Dr. Diya Al-Jumaili, you have any question, Dr. Diya?
Thank you very much. Thank you very much, Professor. Thank you very much, Professor Shakir, Professor Salman, Professor Majid, for this presentation. It's amazing presentation. I have learned so much about the vaccine, and I've got a question and I've got comment. I'll start with question about protocols. There are a lot of protocols being used with COVID-19, especially in countries like Iraq. And I mention Iraq because I know some of the doctors, and this protocol quite successful, I'd say, for dealing with the virus. Do you think that I'm not going to talk about the vaccine, I'm going to talk about the actual protocol. Do you think, Professor Shakir, this protocol, we can use them to deal with the people who are basically suffering or basically getting the virus? That for Professor Shakir.
Okay.
Thank you very much for the question. If you are talking about treatment protocols,
yes.
So treatment protocols are divided according to the severity of the case, and they're published and reviewed by very high level committees in the United States. This is what I'm talking about, and they're published regularly on the National Institute of Health and CDC. Those are the two outlets that they keep on pushing the latest protocols. All those protocols are based on clinical trials, and if the data is significantly showing some reduction in death or hospital stay, depends on the objective of the clinical trial, then they will be adopted and used. And of course, many of the medications, except for very few, are all under emergency authorization use. Those are what we have in the United States. But in general, the main way you can save your people is early intervention by supportive care. By like the only things that have proven and are considered like proven are oxygen therapy, proning, which are not like chemical medicines. They are more like physical approach to the patient, how you treat them. But still, like dexamethasone has proven itself like very effective in preventing people who are on oxygen therapy from death and grave outcomes in a very significant number. In the United States, we certainly use remdesivir. And of course, those monoclonal antibodies and those new cocktails that are emerging are still experimental, but they are showing not bad results. Viruses are very difficult to treat, as you know. And if the protocol is not approved in the United States, we cannot like change whatever we think, and like nobody uses like those medicines used in Iraq, medicines I see, like many of those prescriptions describing azithromycin and all this stuff. They are not, if they are not approved, and the recent treatment guidelines are used based on what is published. That's it. There are no like suggested protocols. You can suggest this to a committee, they can look at it and they can decide whether to go through a clinical trial, and then if it's approved through a clinical trial, it can be used. Nothing can be used if it's not approved by a clinical trial.
Okay.
If I may follow this is important question.
Okay.
From Professor Jumaili.
Yeah.
Thank you very much, Diya. Actually, most of the countries, they have national committees which approve the protocol, as Dr. Shakir mentioned. In Iraq, also, we have the Supreme Advisory Committee for COVID. There are 15 members of distinguished professionals from Iraq. In addition to that, I'm actually a member of WHO, sit on that committee. From the start, the Supreme Advisory Committee approved a very detailed protocol, and it is updated on a regular basis. And the protocol was not only approved by the committee, it was approved by WHO as well. And a protocol like this is a living document, is an organic one. It tends to change almost on daily basis. And the committee is meet every Monday evening, frankly speaking, in addition to other urgent meetings. So we have an update protocol. The problem is, and in a short, is twofold. Many of our colleagues in Iraq, they don't follow the protocol. As Dr. Shakir, they engage almost in personal clinical trial. Because each one have an appetite for certain drugs, for certain things. And it's not, it's not only they engage in it, but also they write on their social media how fantastic the drug and he experienced it, etc. Secondly, we don't have any control on the private sector because we don't know what to do. That's one. The other things in Iraq, which I shouldn't say that, I'm very ashamed to mention it here. We have very large number of people who are not licensed as doctors, okay, practicing medicine, treating COVID, including many vets, dentists, okay, nurses, which are not licensed to treat. They are treating people in a fancy clinic, you know, as well as at home. So just tell me how to regulate that. Thank you. I rest my case.
Okay, thank you.
Thank you very much. Follow on, just please, from Professor Salman. Just thank you very much, Professor Salman, for this very important comment. But we have to be fair also that you were one of the speakers in our Jamia Tabiya Al-Iraqiyya. We did several seminars before on COVID from last year, from early. To educate and a small number of doctors from Iraq, emerging doctors who are very eager to learn and to follow protocols. I must say, they are the tayar. I mean, I lost my word now. Okay,
so against the tie.
Against the tie, excellent. Okay, so. Okay. So they are, and I must say we have to salute them also. Thank you very much.
Thank you so much, Dr. Seema. You have any question, Dr. Seema?
Yes. Good afternoon, everyone. Please, thank you very much for the amazing presentations, and thank you very much for trying to regulate this conflict in terms of culture and language that is going to be used. We want to keep it as peaceful as possible, and we want to keep it away from politics as well, because public health care is still not politics. With that in mind, I have two questions for Dr. Salman, whom I personally admire. I learned, yes, two questions. Okay. Really quick. Yes. Okay. Okay. So the first question is, Dr. Salman mentioned, which is very true, that all vaccines are good. All vaccines serve as the shield against the infection of coronavirus, and we shouldn't be afraid to get vaccinated and teach everyone to get vaccinated as well. With that being said, how do we work on implementing a universal measure? Because you know how it is, we do weigh the balance of the universal risk for of the vaccine, but we do not, many people do not take into account the individual risks, because there are individual clinical cases of patients, based on their own individual clinical histories, which will make vaccination difficult for them or impossible due to the medical diagnoses, either a cluster or individual medical diagnoses that they have. So how do we work on implementing a universal measure on running an extensive, complete physical workup on every single patient worldwide before getting vaccinated, so they already know what their clinical picture is before they go for vaccination? That's question number one.
Okay.
Question number, yes. And question number two, well, I'm actually gonna, allow him to answer question number one first, and then, if we have time, I'll do the question number two.
Okay, Dr. Salman.
Thank you very much, Dr. Seema. It's a really great question. First of all, we need to accept one fact, that the contraindication, i.e. not to use the vaccine, is really very limited. All vaccines, they published fantastic data, because even those people with disease, say diabetes or heart diseases, they are at much higher risk of being infected with the virus and having higher complication from the infection. It's not only about hospital admission as a main complication once we get the disease. There is another fact, Dr. Seema, which you know, that any infection, even mild infection, may lead to long consequences, i.e. this is not an infectious disease per se. It causes an infection, but like HIV, it has and I don't want to compare, by the way. It's an awful mistake to compare, but I'm trying to simplify it. We have evidence now this coronavirus leave damage, which is long-term. I'm one of those people, I got very mild infection, actually. The only things I lost my sense. But after 6 months, suddenly I got some tinnitus in my ear. I said, look, this is maybe aging, By the time I checked, the ENT surgeon, is a good friend of mine, said, look, this is probably 90% related to the infection you got about a year ago. So this is a disease which is a very dangerous disease. We should avoid it at any cost. So the contraindications are very small. Universalities. I think, you see, the ability to cover the 7.5 billion population, including children, once it's permitted, Dr. Majid Jawad said it beautifully. The herd immunity cannot be achieved without covering the children. I'm glad all the vaccine now continuing with the clinical trials, all these companies. Unless that universalities will not happen unless we use all the vaccines available to us. There are 17 vaccines now available. Germany, unless they have somebody like Merkel, 2 days ago, they decided that they cannot get Pfizer enough. They cannot get AstraZeneca enough vaccines available. Germany is the largest European country, decided to contract with Russia. And to hell with politics. It needs courage. It needs political courage. And I go and repeat what my good friend Fauci said, and I keep saying this again and again. Any vaccine in your arm is a good vaccine.
Okay,
Thank you. And question number two, really,
the second question, yes.
Yeah, sure. This is very important. So after having looked at the recent data across Europe, I came across that the country of my birth, Ukraine, has only received 377,000 doses, with people being fully vaccinated, only 5 in the entire country. So I would like to make an announcement or request or proposition to the International Society of Health Education and, if possible, to the World Health Organization. How do we start on implementation on increasing the intergovernmental relationships between Ukraine and the rest of the world, so that our people are going to receive more doses of vaccine? Because as someone who was born in Ukraine, I actually feel very bad for my country. And, you know, and I care about all the other countries around the world as well. And I would like to work with and for other countries too. But Ukraine is now on the low side. So this is that's my second question, offer, you know, whichever way you want to take it.
Okay,
I
thank you.
think you raised a very important point, you know, that global solidarity does not exist, unfortunately. And we have seen that 70% so far of the vaccine available used by the rich countries, mainly United States, Britain, and some European countries. Ukraine is not part of the European countries, part of the EU, as you know. And therefore, Ukraine relied on COVAX. And that the same supply, by the way, the similar population in the Middle East, in Africa, and Latin America, received almost the same amount through COVAX. You know, and that's what WHO really keep warning rich countries, for God's sake, the production of the vaccine is very slow. This is not about printing a paper every day. You can print 1 million, 2 million, 3 million. This is a lab process. It's a very time consuming. And I know the dedication of our colleagues in labs across Europe, in the United States, and Britain, you know, and the Serum Institute in India, and the big company in South Africa, in China, in Russia. They are trying very hard to produce sufficient supply. It's a very, very time consuming. That's why we have shortage in Europe. You know, and people surprised. Most of the factories, including Pfizer factory, is based in Belgium. But yet they couldn't produce sufficient enough. Look at Canada. You know, United States refused to supply them what they need. So that global consensus does not exist. And this is one of the lessons about these pandemics and how politicians around the world mishandle the situation, including United Kingdom. I mean, if there is any criticism that the UK secured about 3 times more than its need from vaccine, which really could be allowed to go to Ukraine and other countries. I love Ukraine as much as you love it, trust me. Okay?
Thank you.
Okay, thank you. Now, Dr. Fadel, are you there, Dr. Fadel? Okay, let us take question from the audience. Dr. Wafa Al-Husseini.
السلام عليكم.
Okay, you can تكلمي عربي. Okay, ماكو مشكلة.
I'm going to talk in English. Thank you very much. It was thank you very much first for these impressive presentations, and I'm happy to see Dr. Salman again. And hello again, Dr. Salman. I'm Wafa Al-Husseini. If you remember me, we've met a lot of times in WHO meetings.
Welcome.
I have a question. It might be for certain individuals, not for everyone, but some people have sensitivity towards vaccination. In other words, maybe they have a sensitivity towards influenza vaccines. So I know people, one of them is me as well, who when I take influenza vaccine, I get a very bad reaction that continues for more than 2 weeks. Is it safe for these people to take these vaccines now for COVID-19 vaccines? And thank you very much.
Okay, who's answer? Dr. Shakir? Dr. Shakir.
Yes, thank you very much for the question. In general, there are 2 approaches to allergy reaction or sensitivity reactions to vaccines. If you have anaphylaxis from any condition, like from any medicine, even if it's not the vaccine, you better avoid and rely on the herd immunity or the unimmune part that will be protected by everybody else when they are immune. The second one is if you have allergy to the contents of the vaccine itself, you should look at it. I know that influenza vaccines use eggs during their preparation. And if people are sensitive to eggs, then probably they shouldn't be taking the vaccine, the influenza vaccine. But the current vaccines used for COVID, they do not use egg. So if you have like this combination, you probably need to look at it. If you are not sensitive to eggs, any sensitivity from any vaccine that you might have developed before would require that you refrain from taking a vaccine right now and wait for some time. That is the general outline of how to approach vaccine sensitivity. It should be like, if you are sensitive to the material, don't take it. That's first. And anaphylaxis isn't contraindication from any drug or medicine, because you are in grave like sequences. You might have grave sequences if you have it. And that is the general outline. So it's not yes or no. You'll have to evaluate your case yourself. Thank you.
Okay, thank you so much. Now, Dr. Tamadar Shumari, you have a question. عربي.
نعم دكتور، شكرا جزيلا. معكم دكتورة تماضر الشمري من جامعة القادسية كلية الهندسة.
أهلا وسهلا.
حقيقة جهود مباركة، المؤتمر رائع جدا، برزنتيشن أروع، وما أحوجنا لمثل هذه المعلومات جميعا، وأتمنى أنه يتكرر باللغة العربية حتى يستفادون من عنده أكبر عدد ممكن من شرائح المجتمع. الحقيقة أنا سويت له بث مباشر، يعني إن شاء الله مسموح لي، وكتبت بالشات، شفت المعلومات جدا قيمة. فعندي بيج بيها تقريبا 41,000 فولور، فنقلت بث مباشر وجتني الرسائل كلها أنه يعني يحتاجون هالمعلومات هاي القيمة، وتعرف الكل أجمعوا أنه تكون باللغة العربية.
فيا حبذا في المستقبل القريب نسوي محلي، لكن هذه هي جمعية عالمية يعني موجهة للعالم بشكل عام، وتحتوي أعضاء من مختلف دول العالم.
صحيح صحيح. يعني احنا نتمنى نقترح انه لو يكون مؤتمر اخر باللغة العربية
ان شاء الله. دكتورة تماضر، سؤالك لمن توجهيه؟
لا خلاص، فقط حبيت ان يعني اثني على هذه الجهود.
شكرا جزيلا على هاي الملاحظة، شكرا جزيلا. شكرا.
اهلا دكتور، شكرا جزيلا لكم.
علياء، اعتقد علياء عندها من الاودينس عندها سؤال. علياء الشكري.
السلام عليكم.
عليكم السلام.
Hello everyone. I'm Aliya Shukri, assistant lecturer in Ibn Sina University. Thank you very much for your very helpful information about the vaccines. Actually, I have 3 questions. Number 1, is the vaccines safe to parents in the age of reproduction? And is it effect on the fetus and pregnancy women? Number 2, are you advise the patients with the autoimmune disease like psoriasis to take vaccine? And what about cancer patients? Like I have a situation, my aunt have 75 years old, and she has cancer in her breast, lung, and neck. Is it safe for her to take a vaccine? And question number 3. Is it necessary to all people to take a vaccine, or we can be enough by 85, for example, percentage from the total number in the region that we are live? And thank you very much.
Okay, thank you so much. Dr. Shaker?
During reproduction, this is a very common question now, whether you can take a vaccine while a woman is pregnant or is about to be pregnant or is lactating. And actually studies are going on right now in the United States and many other places in the world too, just to demonstrate how safe they are. Initial results, it is safe. There is no problem. In the United States, it was never prohibited. It was never not allowed for a woman who works in a place that make her more exposed to the disease. For example, a nurse, a medical doctor, or a dentist or dental hygienist, to take the vaccine, whether they were pregnant or about to be pregnant or lactating. And those had taken it, and all of them did not show any adverse effects from the vaccine. But we are still waiting for more, research-based decision made, not like anecdotal evidence as we have right now. The second question, I think, psoriasis and cancer. Of course, there are two different questions. Psoriasis is an autoimmune condition, and autoimmune conditions are not the problem themselves, but the treatments that you take for them might reduce your immune response. But still, taking the vaccine is not a bad thing, because you will definitely have some kind of an immune response, which will prevent or convert a very severe disease to a less severe, like death to a more severe disease. It's going to downgrade the presentation you have to a more acceptable one. So vaccinations are okay with psoriasis and all other immune disease. Regarding cancer, if your patient is terminal and is very ill and cannot stand up from the bed, it's not advisable, because the reactions sometimes caused by those vaccines might accelerate a process, and you might lose the patient. And that's what happened in Norway in very old people when they started vaccinating people very sick, very old, and they ended up with those deaths that were explained. But in general, a cancer patient who walks and goes for treatment, it's actually advisable to give them treatment, because they might have the more severe form of the disease if they get the disease. And the last one is for, is it necessary for all people? Of course, we all try to get the vaccine as much as possible. Herd immunity is not measured yet, because this is an ongoing pandemic, and all more spreading, more transmissible variants that are coming are actually increasing the coverage rate of the vaccine that will allow us to reach the herd immunity. I like community immunity more. Herd is more like a veterinarian term. So community immunity can be reached, and we will not be able to tell exactly how much until we reach it, and then we can see definite, very high drop. The United Kingdom is showing good signs. Israel and the United States is probably going that way too. United Arab Emirates too also is another country. So it is going to be measured later on, but it looks like it is 70, 80, 90, nobody knows so far. Thank you.
Okay. Thank you so much, Doctor. Dr. Khalid Shafi, you have any question?
Thank you very much. Thank you for the speakers. Actually, they're very informative and very encouraging to everybody. And I don't think anybody will refuse the concept of herd immunity and need to be immunized. But it strikes me that this disease needs a lot of studies, because first of all, divide the community into what you call it, anti-vax and pro-vax. And the other thing, because nobody, in my actual experience for the last 40 years, nobody questioned vaccination before, only this time. So the burden is about education and confidence of the people. As you know, we have actually, through the last 14 months, we are changing our understanding, because initially there were some people do not believe in herd immunity. Now they are believing in it. Some people initially, or most people, do not wear masks. They wear gloves. Now changed. So it is very important that we need to know more about the disease, especially the epidemiology is changing. Initially, it's affecting the elderly, the immunocompromised. Now it's moved down to the healthy young age group, which another interesting thing. One correction to one of the speakers: virus is a living organism, but it is very much dependent on cells. And in infection control, we need to culture the virus to make sure that it is a cause of cross-infection or not. If it is dead, then we say it's insignificant. Now, my question is that because we know those anti-vax, now there is a huge group of people who are not convinced to be vaccinated. And then the issue of passport vaccination is a huge human right issue now in the Western countries. I don't know about the third world countries. And are we going to discriminate against those who are not convinced? Because having a complication, as one of the speakers said, or one of the commenters said, it's about the probability. And if I am taking, or some ex taking the vaccine, what is the probability of having the clots? And the clots are very, very serious, and from the same pathology of the disease. It's not just like other, allergic or a reaction like anaphylaxis. So we need to know how to convince, not to discriminate against those people who are a bit hesitant and cautious about having the vaccine. And the question is to everybody. Thank you very much.
Okay, thank you so much. Dr. Shakir? Mute you.
You're muted.
Oh, okay.
You are muted again, Shakir.
I'll mute.
Yeah.
Okay.
Okay, thank you.
I just want to thank Dr. Khalid for his comment. And it's the debate between viruses are alive or not. It's the word replicable that is what describes the virus activity. It's not whether it's living or not. That's what as far as I know, I respect his opinion. But replicability is what describes the living viruses, because they can continue replication, and this cannot happen spontaneously unless they are inside a cellular media or a human or animal or plant cells. So once they are inside the cell, they can use the machinery of those cells, the organelles of the cell, to replicate, but they cannot do it themselves outside, except for very few examples. So that's in general. But otherwise, I think the viruses and vaccination hesitancy, I think it is not only for this vaccine. There are very famous stories, cartoons and pictures about people resisting polio virus, which was crazy, resisted, and even some other diseases, including smallpox. And people were always afraid of introducing a new thing to their bodies, and they think they can tolerate, they can escape, they can try. It is kind of a chance, how much you have a chance. Viral diseases that are transmitted by respiratory route, what we have right now, especially those that are not only dependent on droplet infection, but also on air transmission and aerosolization of the air, is always something very dangerous and should be seriously taken, because you can get the infection just by getting into an elevator or by getting into a car or into a bus, public transportation, and this will not end unless we reach the community immunity or herd immunity. And it depends. We cannot tell how much, because this is an ongoing pandemic. It is speculated to be 80, 85 probably, but that will depend on how much the reproduction rate of the virus goes by the end when we are stabilizing the condition. And I think Dr. Salman can add probably more to that point I mentioned. It's more a public health issue.
Thank you so much. Dr. Jassim Al-Azzawi, if you're there, Dr. Jassim. دكتور جاسم.
نعم عيني دكتور ميثم حبيبي.
قبل ما نختم كلمة أخيرة من حضرتك.
والله عزيزي أقول شكرا جزيلا لهاي الجهود الرائعة، يعني أنتم فريق متكامل من كل النواحي، وإحنا حقيقة يسعدنا أنه نشتغل وياكم ونقول فريق واحد، ونتمنى أنه تكون تمثل النقابة أيضا باللجنة العليا للصحة والسلامة، وقد يكون دكتور سلمان حبيبنا يقترح هذا الموضوع، لأن تدري حضرتك أنه النقابة مهمشة على مدى عشرات السنين بسبب تجميدها للفترة السابقة، وهي ظهرت للعيان عام 2017 ولحد الآن تحاول أنه تسترجع صلاحياتها. النقابة بها قانون، والقانون قوي، والقانون يتمثل بشغلتين أساسية. الأولى المهنة الطبية كلها من اختصاص النقابة، الارتقاء بالمهنة الطبية والحفاظ عليها، والنقطة الثانية هو الارتقاء بالأطباء ومتابعة شؤونهم في مؤسسات الدولة جميعا وفي القطاع العام والخاص، وهذه مهمة كبيرة. النقابة ذات نفع عام ونفع كبير، وهي احدى الاشياء، احدى المؤسسات المسؤوله عن انشاء نظام صحي حقيقي. واحنا ودكتور سلمان الله يحفظه مشتركين في الموقع، حاولنا ان نفتحه بس هي الظروف والوقت غير متوفر بالنسبه لنا، ونتمنى انه نطور هاي الامور. احنا استمرار هيك فعاليات تضعنا في مطاف الرقي والعلو في سبيل انه نوصل بالبلد للي احنا وانتم تردوه. احنا همين راح نوجه لكم دعوه ان شاء الله بزياره العراق في مؤتمر قاعد نخطط له، وقد يكون عنوانه هو الكوفيد 19، وحضراتكم كلكم مدعوين. وهذا هو بالحقيقه التوجيه من رئيس الوزراء، بس بشرط انه هم ما يدفعون ولا فلس، نقابه كلها تتحملها. بس هم يهيئون القضايا اللوجستيه والامنيه والى اخره، والاستراحه والاستقبال والتوديع. ان شاء الله تكونون في اعلى مستوى. وحقيقه انا اليوم احد التلاميذ الذين استفادوا كثيرا من هذه الجلسه، ونتمنى انه تعيدوها وتكرروها ونستمر بالتعاون. حبيبي واشكركم جزيل الشكر.
شكرا جزيلا، شكرا جزيلا دكتور جاسم نقيب اطباء العراق. كلمه اخيره واللغه العربيه حتى ما يزعلون دكتور شاكر حتى
شكرا جزيلا. انا بالواقع معظم المحاضرات اللي اسويها في كل اللقاءات، يعني عشرات ما اعرف 20 30 لقاء صار سويت، كلها اسويها باللغه العربيه متعمدا، لانه حتى توصل الى ابعد ما يكون من الناس. وتجيني رسائل مركز صحي بتكريت، واحد جاي دا يلقح يقول انا شفت شاكر جواد دا يحكي وجد لقح مثلا، لان باللغه العربيه هو مفهومه. فاحنا يعني شرفنا نتحدث بلغتنا الام، بس بسبب هذا الاجتماع كان بخصوصيه انه نحكي باللغه الانجليزيه، فسويناه باللغه الانجليزيه. وانا اشكر كافه الاساتذه الحاضرين اللي قدموا محاضرات وشاركوا، واللجنه اللي نظمت هذا اللقاء، والنقابه، وكل الحضور الكرام على تشريفهم ايانا، ونتمنى ان نستمر بهاي اللقاءات. شكرا جزيلا.
شكرا جزيلا، شكرا جزيلا. دكتور سلمان باللغه العربيه حتى ما يزعلون، كلمه اخيره.
شكرا جزيلا، شكرا جزيلا للجميع والمتحدثين والمشاركين، وشكرا على الاسئله الكثيره اللي طرحت. انا الحقيقه تابعتها، يعني معظمها اسئله وجيهه، للاسف ما صار مجال نجاوبها، بس سؤال واحد تسوى انه نناقشه: هل تعطى جرعه ثالثه؟ والحقيقه النقاش حول الجرعه الثالثه الى حد الان مبكر. يعني التفكير الان كله يتجه انه الجرعه الثالثه قد تكون في اللي استلموا اللقاح الان، خلينا نقول في الشهر الثالث. ممكن أن تكون الجرعة الثالثة اللي هي البوستر في الشتاء، يعني شهر ال 11 أو ال 12، يعني مو قبل 6 أشهر، لأن نتوقع أنه اللقاح يعطي مناعة على الأقل لمدة 6 أشهر. يعني هذا المعلومات المتوفرة. طبعا عندنا خبرة لمدة 3 أشهر معلومات. فأنا أريد أختمها بكلمة واحدة من أعماق القلب: شكري الجزيل للمنظمين، وخصوصا شكري للمشاركين الجمعيات الطبية في بريطانيا. ولو دكتور جواد راح يريد يحكي، دكتور مجيد، بس ما راح نسمح لك لأنه الوقت ما يكفي.
دقيقة واحدة فقط، دقيقة واحدة نختمها.
يلا دقيقة مجيد، تفضل.
مو الأخوة والأخوات اللي رادوا باللغة العربية، شكرا جزيلا لكم جميعا. بس احنا نقول لهم احنا عندنا راوند تيبل برمضان نسويها الجمعية الطبية العراقية ويا الأخوة بالعراق كل ليلة، حتى ويدسكس نيو توبيك كل ليلة برمضان. وطبعا الجمعية الطبية العراقية تعرف احنا دعينا حتى جماعة 5 مرات سوينا على الكوفيد، بما فيها اللونج كوفيد اللي تفضلت عليه، اللي نسرين العلوان قدمتها ايضا، وهذا فمستمرين وان شاء الله نقدم لهم اكثر. وشكرا جزيلا. واريد اشكر دكتور جاسم العزاوي لجهوده الرائعه، ودكتور شاكر جواد اجين. شكرا جزيلا.
مشكور شكرا لهم نيابة عن الجميع. And on behalf of everyone, by the way, I apologize. We shifted a little bit in Arabic toward the end. I apologize for my international colleagues. I promise that we will finish in Spanish next time. Sima, I can promise you to finish in Ukrainian.
Yes, yes. Dr. Salman, Dr. Maytem.
UK Iranian, you know?
Yes, Dr. Salman. Yes, I just want to make a quick comment, and it's actually something that goes along with what Dr. Shakir mentioned. It is true, you know, I'm a critical care specialist, but it is true we follow protocols and guidelines, and I emphasize in the United States because the American public is very quote unquote individualistic. So they call it guidelines, suggestions, summary statements, consensus statements. So in other words, we give you advice. But the real problem that we should address at a future conference is the fact that for the past year, my colleagues and I have had to create an 800 number for the COVID patients that are at home. The ones that are not sick enough to be hospitalized, but are at home sick, and unfortunately sometimes get too sick and end up being hospitalized. And I can tell you that nobody is really addressing the COVID patients at home. And sometimes we have to treat them with whatever it is that we have, including the kitchen sink. And this is a real problem because now it's not just those patients that were hospitalized and very sick, but the ones that never got too sick to be hospitalized. And now we're starting to see long-term chronic illness in these patients also. And I can tell you that, you know, Mount Sinai Medical Center here in New York City 2 months ago created, and I taught at Mount Sinai for 25 years, created a post-COVID syndrome clinic. But again, we need to talk about the COVID patients that never got sick enough to be hospitalized, but that were home. And these are the ones that, as Dr. I apologize, Jumeli, right? Was mentioning, and sometimes as physicians we're forced to come up with cocktails, and we need to address that because sometimes these are the realities of the clinical practice in medicine in the communities, and we have to try to bring it to the forefront and try to own it also. Thank you.
Professor, I think you just volunteered yourself for the next keynote speech about this topic. Sorry about that.
Okay, thank you so much. It was really a very informative talk and lecture to improve our knowledge about COVID-19, vaccinating, and debates. We meet you in the near future, new trending subject. See you and stay safe, please.
Thank you. Thank you, Maytham.
Thank you very much. Excellent as always. Excellent as always.
Professor Maytham, thank you very much. You've been done very, very well with organizing this conference, and we have to thank you. Actually, you've done a lot of work behind the scene. Thank you very much. Thank you.
Thank you.
Bye-bye.